Anatomy and function of the knee, ankle, and foot joints. The knee, ankle, and foot are among the most complex and functionally vital regions of the human musculoskeletal system. These joints not only support body weight and enable locomotion, but also provide dynamic stability and shock absorption during daily activities. Understanding the structure and function of these regions is essential for manual therapy practitioners working with lower limb pathologies. The knee joint complex. The knee is one of the largest and most intricate joints in the human body. It is formed by the articulation of four bones: the femur, thigh bone, tibia, shin bone, patella, kneecap, and fibula. While the fibula does not directly participate in knee joint movement, it contributes to the structural integrity of the lower leg. The knee comprises two primary joints: the tibiofemoral joint. This hinge-type synovial joint connects the medial and lateral condyles of the femur to the corresponding condyles of the tibia. It is supported by the medial and lateral menisci, which are wedge-shaped fibrocartilaginous discs that absorb shock and enhance joint congruency. The tibiofemoral joint primarily allows for flexion and extension, with limited medial and lateral rotation when the knee is flexed. The patellofemoral joint. This saddle-shaped joint is formed by the articulation between the patella and the anterior aspect of the distal femur. It plays a key role in increasing the leverage of the quadriceps tendon during knee extension and stabilizing the knee during movement. Together, these joints are enclosed in a single synovial capsule and function as a modified hinge, transmitting body weight both vertically and horizontally. Tibiofibular joints. Two joints connect the tibia and fibula. The superior tibiofibular joint, a plane-type synovial joint located between the lateral tibial condyle and the head of the fibula. It dissipates torsional stress during ankle movements and accommodates lateral bending forces. The inferior tibiofibular joint, a syndesmosis that connects the distal fibula to the lateral tibia. Strong interosseous ligaments maintain its stability. During dorsiflexion, it allows the lateral malleolus to slightly rotate outward, ensuring the integrity of the ankle mortise. The ankle joint, talocrural joint. The talocrural joint is a hinge joint formed by the distal tibia and fibula, forming a mortise, articulating with the dome of the talus. Supported by robust ligaments, this joint allows dorsiflexion and plantar flexion of the foot. The talus acts as the pivot for ankle movement, and the axis of rotation shifts dynamically with joint loading and position. Subtalar and midfoot joints. Subtalar joint, also called the talocalcaneal joint, it is a multiaxial synovial joint located between the talus and calcaneus. It facilitates inversion and eversion movements. Talocalcaneonavicular joint. This compound joint connects the talus with the navicular and calcaneus bones. It includes both the anterior talocalcaneal and talonavicular articulations. It supports complex movements like plantar flexion of the talus over the navicular. Calcaneocuboid joint. This joint links the calcaneus to the cuboid bone and is among the least mobile in the foot. It plays a subtle role in complex foot motions described as obvolution and involution. Forefoot joints. Tarsometatarsal Lisp joints. These arthrodile joints connect the distal tarsal bones, cuneiforms and cuboid, with the bases of the metatarsals. They are reinforced by interosseous, dorsal, and plantar ligaments, permitting minimal gliding movements. Intermetatarsal joints. These synovial joints connect the bases of adjacent metatarsals and allow small, stabilizing movements during weight transfer. Metatarsophalangeal joints. Ellipsoid in nature, these joints connect the heads of the metatarsals with the bases of the proximal phalanges. They enable toe flexion, extension, abduction, adduction, and circumduction. These hinge, ginglymus joints include both proximal and distal sets between the phalanges. Their main function is flexion and extension of the toes. Normal range of motion? Knee joint. The knee joint allows a wide range of movements vital for walking, standing, and athletic activities. The primary motions include flexion, extension, and slight rotation when the knee is flexed. These are typically assessed with a goniometer. Flexion, 120 to 150 degrees. Extension, 5 to 10 degrees. Lateral rotation, knee flexed 90 degrees, 30 to 40 degrees. Medial rotation, knee flexed up to 10 degrees. Age-related ROM data show a gradual decline in flexibility with aging, especially in flexion, while extension remains relatively stable. Age group, flexion, GRI, extension. 2 to 8 years, 147.8 to 152.6, 1.6 to 5.4. 9 to 19 years, 142.2 to 142.3, 1.82.4. 20 to 44 years, 137.7, 41.9, 1.1.6. 45-69 years, 132.9 to 137.8, 0.51.2. Sources: Schinke et al., 2006, Susi et al., 2011.